Welcome everyone to this concurrent session on disability inclusive COVID response across Asia and the Pacific. My name is Paul Deany. I am the moderator for this session. I'm an advisor with CBM Global and identify as a person with disability as I have bipolar. I should note that there is live captioning for this session and we've put a link in the chat if anyone wants to, there it is now, if anyone wants to use the live captioning option. Today, I'm joining you from St Kilda in Melbourne, which is always was and always will be Boon Wurrung land. We acknowledge the Boon Wurrung people and all peoples of the Kulin Nation as traditional custodians of this land and acknowledge their elders past, present, and those that are emerging. Today, we're incredibly lucky to have some key leaders from the disability movement across Asia and the Pacific to talk to us about the impact of COVID-19 on people with disabilities. And I would like to welcome our three speakers, Cucu Saidah from Indonesia, Ruci Senikula from Nepal, and Ruci Senikula from Fiji. And I'll be giving them more detailed introductions when we come to each speaker. Earlier this morning, in the opening plenary session, we heard from Lanieta Tuimabu from the Fiji Disabled Persons Federation. She talked about the slogan of the disability movement, nothing about us without us, and what that has meant during the pandemic as her organisation stepped up and partnered with government to ensure no one was left behind in COVID responses. COVID-19 is bringing into sharp focus inequities in the developing world. This week, it was reported 44% of the global population have received at least one dose of the COVID vaccine. But for low-income countries, this figure is less than 2%. And for countries like Yemen, South Sudan, and in our region, PNG, that figure is less than 0.5% who have received one dose. Added to this, the UK journal The Lancet has reported that people with disabilities are 2 to 3 times more likely to die of COVID. Other research suggests this figure is much higher for developing countries. So what has been the impact of COVID on people with disabilities in our region, and what can we do to partner with this group and with OPDs, organisations of people with disability, around COVID? The WHO has identified that people with disabilities as one of the most vulnerable populations in public health emergencies, disproportionately affected by the health, social and economic impacts of COVID-19. From the countries we're hearing from today, Indonesia, Nepal and Fiji, we have seen the devastating and far-reaching impacts of the pandemic. And as we have seen in other recent emergencies and disasters, people with disabilities are most at risk. COVID-19 is deepening pre-existing inequalities, creating a perfect storm where the barriers facing people with disabilities are increasing, but people with disabilities are often still at the back of the line in COVID responses. Research by CBM Australia and the Australian Disability and Development Consortium, ADDC, clearly shows that concerted efforts are not made by our government and by our sector and other governments to actively target people with disabilities in COVID-19 responses. This group will be further left behind, meaning development as a whole will suffer. I have a saying that if development does not include disability, it is not good development. So with that in mind, we have a great opportunity now to hear firsthand from some champions from our region, and also consider and discuss how we can engage better with disability organisations to ensure our work is inclusive. There will be time at the end of the session for questions and discussions, so could participants hold any questions to the end and then post them in the chat. And with that, I would like to introduce our first speaker, Ruci Senikula, who is Administration and Program Manager for the National Federation of the Disabled Nepal, NFDN, an organisation that advocates for the rights, interests and entitlements of persons with disabilities across Nepal. NFDN now has more than 300 member organisations in 74 districts and works in coordination and partnership with national and international government and NGO bodies to establish disability inclusive structures, laws and systems to enhance capacity and promote meaningful participation of persons with disabilities. Manish is an experienced advocate and program manager within the disability movement. So with that, I will hand over to you, Manish.
Hello, everyone. Good morning from Nepal. It's very nice to see you all through this virtual connection. First of all, I would like to thank the organizer for providing this wonderful opportunity to my organization to share our learning and experience on this important platform. Today, I'm going to share within this 10 minutes, I'm going to share our learning and experience in the situation of COVID-19 pandemic. Like other places of the world, the COVID-19 pandemic affected Nepal severely. Persons with disabilities were affected disproportionately. Various studies and assessments showed that they are at high risk of COVID infection as well and left far behind in healthcare, relief, response, and recovery. With the first wave of COVID started in 2020, we assumed that the persons with disabilities could be most affected in the pandemic. Based on our knowledge and information, we therefore issued and disseminated a general guideline for all stakeholders and persons with disability. We appeal that people with disabilities should not be discriminated against in the treatment, proper care, and COVID-related information. The first wave was really panic for persons with disability because there were so many rumors, fake news, and information about COVID infection and its effect to the human body. Persons with disabilities faced a number of barriers to have access to authentic information. The daily coming fake information and news promoted a kind of stigma towards infected people. Because of this, the people with disabilities were left by their personal attendants, helpers, and caretakers at home and rehabilitation center. They were deprived of their regular health services and other social protection related services. During the first wave, we conducted a rapid assessment on the impact of lockdown and travel restriction in the life of people with disabilities. From the assessment, we found that many people with disability had lost their daily income. They were deprived of health services, health facilities that they were getting before. They had no access to relief materials that the government was providing. The COVID-related information was not accessible to them. They were under mental stress, and in some places we also found that they were facing abuse and violence at home and family. Based on this fact, we mobilized our structures, our local organization of persons with disability for advocacy at local level. In collaboration with CBM Global, we conducted a short-term COVID response program in the 4 municipalities of Kabre and Sindhu-Palchok districts. The project was in the consortium model where CMC and SAPROS were our consortium partners. CMC is the organization working for psychosocial disability, and SAPROS is very experienced in the livelihood related project and activities. So through the consortium project, we used the expertise of service delivery, information dissemination, and advocacy jointly to respond to the COVID pandemic. In this project, we mobilized our local organization of persons with disability to collect the data of affected people, conduct advocacy with local government, build coordination with other humanitarian actors, and disseminate COVID-related information among persons with disability. We tried our best to make the information materials in an accessible format, such as audiovisual, sign language, simplified language, pictorial presentation, etc. In collaboration with CMC, we conducted psychosocial counseling with SAPROS, psychosocial counseling with CMC, and with SAPROS, we distributed basic needs and hygiene related materials to the affected persons with and without disability. those who were socially and economically marginalized and left behind. To make the decision-making process fair and inclusive at local level, we exercised a disability inclusive COVID response committee in the targeted municipalities, which included the representative of all stakeholders and organization of persons with disability as well. This committee facilitated basically to many persons with disability to have their access in the services that the local government provided to the COVID affected people. At the national level, we influenced the Ministry of Health and Population to add sign language services in its daily COVID related media briefing. We produced and disseminated various awareness material in an accessible format from YouTube channels, from our social media and TV channels as well. And later on, that was replicated by the government, UN agencies, and other INGO as well in our technical support. We raised the problems and issues of persons with disabilities in the UN cluster meeting and requested the stakeholders to conduct disability inclusive COVID response in their working area. In the second wave started from April 2021. During the second wave, the vaccination also started. However, the experience of second wave was different than the first. This time, the level of stigma was reduced because the government, NGOs, and INGOs jointly promoted the authentic information about COVID-19 and about the measures to be taken to stay safe. There was no much scary situation among the people. They knew lots of things about COVID pandemic and COVID infection. The access of people with disability to authentic information also increased in second wave. We influenced the Ministry of Health and Population to make a policy to prioritize persons with disability in COVID vaccine. The ministry made the policy and circulated it to its local agency. People with disability directly benefited from this policy. From the project implemented in consortium model, we learned that many problems can be solved by joint venture, even in a very difficult situation. Through the consortium model, we learned to apply the expertise of different organizations for the same purpose and develop knowledge to give a synergic effect to the project outcomes. We learned to solve problems through virtual platform. We learned to work using virtual platform as well. And the most important thing, most important thing is from this exercise, we also proved that in the situation of humanitarian emergency, persons with disabilities are not only the beneficiaries, but they are also the contributors. Using the same type of consortium model, we are now implementing another short-term COVID response project in partnership with CVM Global in Karnali. The Karnali is very remote geography of Nepal. We are working in three local units of Jumla districts. The consortium members of the project are NFDN province chapter, the province chapter of Karnali province, NFDN federal office, and CMC is there again with us, and our new consortium partner is INF for service delivery part. So finally, currently the situation is getting better than before. We are focusing our intervention now to influence the recovery plan of the government. We are in dialogue with National Planning Commission, Ministry of Women, Children and Senior Citizen, Ministry of Federal Affairs and General Administration, and hopefully we will be able to influence in the recovery plan of the government as well. So, okay, I think I don't have much time now. Now I would like to end my speech here. Thank you all for listening to me and giving me and my organization this beautiful opportunity. Thank you. Thank you very much.
Thank you very much, Manish. I think that was a really remarkable, comprehensive response that you outlined there. And I know I have a few questions on that. And as I mentioned, if people have any questions, could they please keep them to the end? But I think it was a really fantastic shift from the first to the second wave to see how you were able to break down some of the misinformation that was happening and some of the fake news, and also to really work in partnership with government and then with your own local chapters to really get a response that was much more inclusive and address some of those barriers and challenges that you were facing, particularly in the first wave. So thank you very much, Manish. And now we will go to our next speaker, Cucu Saidah. And Cucu is a disability inclusion consultant with over 18 years of experience working on disability rights issues, working through partnerships with organisations of people with disabilities. She founded the organisation's Persons with Disability Bandung Independent Living Centre, or BILIC. She has a Master's in Public Administration and Policy from Flinders University, South Australia, and is now a disability inclusion advisor in Indonesia, working with a wide range of organisations and INGOs, including CDM Global. So with that, I'll now open the floor to you, Cucu.
Thank you, Paul. Hello, everyone. It is an honor to be here today to share the impacts of COVID to persons with disabilities in Indonesia. I think we are all agreed that because of the existing barriers, COVID-19 adding to the vulnerability for persons with disabilities. So in the early period of the pandemic in April 2020, I myself and two other colleagues from disability movement, we had discussion on how DPOs would respond to COVID-19. So from that, we agreed to set up a WhatsApp group as a platform to create a DPO network to COVID. Then our first action was rapid survey impact of COVID to persons with disabilities in Indonesia. So from that survey, we had 1,683 respondents or people with disabilities from 32 provinces. So one of the findings that 44% of them were women, and 55% of them were economically active before the pandemic. But then during the pandemic, the 80% of those who were 55% identified are losing their income. So they are even difficult to cover basic needs such as food and even for pay the rent. So from that, from the survey that's we do the collectively, everyone does voluntary. So that what's one of the reflection from that is that the collective action triggering disability movement stronger than before the pandemic, because everything done by online. So we feel that there is no border anymore. So DPOs is now involved in different forums of development and humanitarian. So not only in COVID response. For example, action against bullying persons with disabilities in social media, advocacy on the discrimination on the basis of disability, also the sign interpreter provisions in the television and other forums. Also and then from that, we took this movement into the second survey that's more focused about the impact on the socio-economic. And this currently is now finalizing in the report finalizing. And then one also the most important is that currently the DPO's network is working on the social protection policy paper. So one point that I could highlight from this outbreak is that now persons with disabilities have the room to voicing their own voice. I'd like to one of the findings from the second assessment was data on disability, also regarding the access to social protection. And the most important is also we found that resilience of people with disabilities by the work of DPOs or contribution of DPOs in combating COVID impact to people with disabilities. So in the meanwhile, in the recommendation, as a recommendation appear in the policy paper draft that we are working now, is that it's not finalized yet. So is that there is a need to improve social protections for persons with disabilities, where one of them is that disability extra cost should include as an indicator in the social protection scheme. So I think because we have the limited time, I will stop here. So I hope this experience bring us to consider more support to improve DPO's network in the various development of development agendas. So for example, improving level of DPO's engagement in the program cycles. But also it is important to give the opportunity for persons with disabilities in the strategic position, yeah, and also the leadership role. It is very important. So those are the reflection actually from what has been done in the disability movement in Indonesia. So I think hopefully I'm not talking too fast, but I'll give more room for the questions, and then I'll hand back to Paul. Thank you.
Thank you very much, Cucu. No, that was very clear, not too fast, and we're actually going really well with time, so we'll probably have a bit more time at the end for discussion. And yeah, I think again, that was really remarkable how you were able to mobilize the movement, this policy paper that you're producing will be very interesting to see what that comes up with and to see what are the next steps for the movement. I'm interested about the point that you made about how people were able to mobilize online. Perhaps a question I have around there is that, from what I understand, perhaps you were saying it was easier to do it through online, and we can come up to those points when we come to discussion. But for now, I'd just like to ask everyone to join me in thanking Cucu. I think that was a really interesting presentation. And that brings me to our final speaker, which is Ruci Senikula from Pacific Disability Forum, or PDF. So Ruci Senikula is a disability rights advocate from Fiji and currently works as a program officer at the Pacific Disability Forum, or PDF, which is really the peak umbrella body for OPDs, or disability organisations across the Pacific. Her role includes working with youth with disabilities in the Pacific region and Indigenous people with disabilities, and managing grants for COVID-19 responses. Ruci is passionate about advocating for disability rights and ensuring all are included in their communities across the Pacific, particularly young people. So with that, I'll hand over to you, Ruci.
Thank you very much, Paul. Good afternoon to you all from Fiji. This afternoon, my presentation will be based on 3 parts. Firstly, the challenges and impacts of COVID-19 for persons with disabilities in Fiji, the vaccination efforts, as well as what OPDs are doing to respond to the COVID-19. So persons with disabilities are amongst the most marginalized groups in Fiji under the normal circumstances. The COVID-19 pandemic not only further exacerbated their current challenges, endangering them to be further marginalized. The impact of COVID-19 nationally to families of persons with disabilities has expanded their vulnerability directly and indirectly. While nationally, there's a lot of efforts to safeguard the general population from the virus and the vaccinations, the basic humanitarian needs of persons with disabilities needs additional targets looking at the inclusion of the person. Gaps often result from one-size-fits-all approach, which can also lead to secondary complications and also immature deaths. Ensuring that the information and communication platforms is also accessible to persons with disabilities is crucial to make the most informed decision. Currently, many persons with disabilities receive information relating to COVID-19 through informal platforms and third parties, which are often not credible and also misleading. The support to organizations of persons with disabilities is vital during this pandemic, taking into consideration the role that they play in supporting persons with disabilities and their families. Their experience and relationship with their members are important in this crisis, not only to ensure disability appropriate support is available, but also strengthening the OPDs post-COVID-19, as these OPDs continue to be the primary go-to for persons with disabilities. Many persons with disabilities, especially those with severe impairments, may easily be excluded to current efforts due to inaccessibility, environmental barriers, and also discrimination. There is also a growing risk to congestion of persons within the home due to movement and other restrictions. Abuse and neglect to persons with disabilities is our reality now more than ever. This also includes neglect of sanitation and hygiene requirements for persons with disabilities with high support needs. And also, while there is support for food ration, it is to be noted that the efforts by PDF provided through to the OPDs is solely to provide support to persons with disabilities, but not to overlook government's efforts, particularly in providing for the needs of persons with disabilities who live on the streets, as they are more vulnerable and vulnerable in contracting the virus in the current situation that they live in. So the vaccination efforts in Fiji, the OPD responses to the vaccination efforts in Fiji have been difficult due to the following points. Firstly, is the numerous misinformation through social media platforms, those posts that go up on Facebook, those videos, and then people commenting on them. And also the persons with disabilities are not sure of how their bodies would react to the vaccines, and this causes a lot of anxiety, fear, and worry. And also persons with disabilities are unable to get to the vaccination site due to transportation higher cost and also the inaccessibility of these facilities. So how did the OPDs respond to this COVID-19 crisis? They work together with the disability unit that's under the Ministry of Women to ensure that pathways are also created for persons with disabilities who cannot come to the vaccination sites. So health workers take down the vaccination to the homes of these individuals. PDF organized a vaccination webinar with WHO, and there was also an immunization specialist that was present. This was attended by the OPD staff, and it enabled them to also clarify their doubts and verify all the misinformation that they have been following on social media. Through donor support, the OPDs will be able to provide transport to their members for health clinic visits, vaccination efforts of these persons with disabilities to and from their homes. These are provided particularly for those with physical impairment, wheelchair users, and those who also have high support needs that will require continuous support and assistance from their carers. The provision of inclusive IEC materials, such as the videos depicting how persons with disabilities, for example, those with high support needs, are able to properly wash their hands with their carers. And also the videos also have how persons with disabilities can frequently wipe down the frequently used assistive devices like wheelchairs and white canes, and also the production and distribution of pocket-sized pamphlets. These pamphlets have disability inclusive preventative measures of how each impairment can safely practice the preventative measures by themselves or with their carers. And we also have the production and distribution of guideline tools for persons with disabilities and their families excuse me, and also for disability service providers. So these tools also have disability inclusive preventative measures that can be safely practiced by persons with disabilities and their family members or their carers, as well as the preventative measures that can be practiced while at work for disability service providers such as the OPDs. Currently, we also have the provision of accessible information for those who are deaf and also those who are blind, either it be in sign language, through sign language interpreters, through translation into Fijian language, through translation into simplified language. We also have the provision of wash facilities for 10 homes for those persons with disabilities who are wheelchair users or have high support needs. And this is also donor funded work that has begun from this year, September, and will end by June next year. So that is all that I have prepared for the presentation this afternoon. And thank you for listening. Back to you, Paul.
Thank you very much, Ruci. Again, that's a really impressive array of work. It sounds like you've been very busy and producing a very comprehensive response. That brings us now to a little time for discussion, and I would ask if people do have any questions, if they can post them in the chat. But I guess one thing that struck me was just the amount of work that for all three presenters that was placed on OPDs and the disability community. It was certainly a lot. We're running a few minutes early. I'll just briefly touch on the fact that CBM Global has just been carrying out research about how better to engage with the disability movement in the time of COVID and understanding what have been some of the pressures. And we have certainly found that OPDs, disability organisations, are often the first point of call, both locally and internationally, for responses. And in that sense, they are often quite swamped with information and a lot of demands from their members, from the government, different departments in the government, from civil society organisations, and then for responses and information to provide to their international partners, such as CBM. So we've been asking about, well, what were some of the issues? And certainly there were, that people were quite overwhelmed, that perhaps, I think has been touched on by a number of our speakers, the issue of just getting information on different platforms and working remotely has been challenging. I think one thing that was noted in all the presentations was just how to kind of counter and respond to the misinformation that is around there. Another factor that we saw in our research, and I think this has really been borne out in all our speakers today, was just that OPDs have a lot of practical on-the-ground needs for their members in terms of PPE and information and food and social protection and just basic needs that people have on the ground. And that may be sometimes out of sync with how the international community perceives the way OPDs can be responding and doing more higher level advocacy to government when there's actually some very fundamental basic needs on the ground. So I guess that leads me to an opening question. And I might ask now that we open up the discussion of Ruci and Cucu and Manish, could you pop your cameras on? And then we might direct questions to either you individually or to all of you, and one can speak up first. But I'll start with you, Ruci, just on the basis of your last presentation. It did seem like there was a large amount of demands that were placed on OPDs in Fiji. How do you feel, what were some of the greatest challenges for the OPDs in terms of the amount of work that they suddenly had to do and for their staff? What were some of the biggest challenges that they faced?
Thank you, Paul. When the pandemic came into Fiji for the OPDs, one of the great challenge that they were facing is that they had to work from home. And because due to the limited resources, the problems faced, connectivity problems. So these were some of the challenges that they had to deal with. And also when there were borders put in place for the lockdown areas, so some of the OPD staff lived not in Suva, they lived in other towns. So they were not able to at least come to the office to get what they needed, to get proper access to internet, and also to also there was not enough resources, the provision of recharge cards that will enable them to do their work efficiently from home, making calls and speaking with the Ministry of Health and also the Ministry of Women. We also had the procurement of food rations and PPE kits for persons with disabilities, and one of the major challenge that the OPD faced was the storage of this procurement. So, for example, there was 1,600 PPE kits and about 200 food hampers to be procured. So, what they did with this was they were able to negotiate with the service providers. So instead of getting the 1,600 PPE kits, they would bring it in bulk, small bulks of 400, and that will enable them to easily distribute and then go back and get more. But in general, the OPDs faced a lot of difficulties in these areas, and also mostly it was the communication challenge due to the connectivity, and also they were not able to get proper access to do their shopping. So limited movement was limited, and thankfully through the provision of food rations and also the PPEs, some of them it enabled them to at least go to the shop or catch a bus to go and do their shopping, because they now have the essentials that will that should help them prevent themselves from getting or catching the virus. Thank you, Paul.
Thanks, Ruthie. And just as a follow-up to that, how about reaching people in some of the more remote islands and regions? Were there particular challenges in getting to those people with disabilities?
Okay, so we had a project with funded by WHO, and it was for 11 countries. So we worked very closely with the OPD staff, the office managers, and in these countries, they also formed the COVID-19 resource teams. And part of the project was to do community awareness. So the 11 countries were able to conduct community awareness at the local grassroots level, as well as, for example, with Palau and Aremai, when they went out to the other smaller islands, they worked with the Ministry of Health. And for Fiji, they were able to conduct community awareness with the police and also the village nurses and the village health workers. It was not easy going out to the outer islands because when we were engaged with the WHO project, most of the countries had not contracted the COVID. So at that time, they were able to work closely with the Ministry of Health or the Disability Focal Point. But when these countries some of these countries started to have numbers of COVID-19 cases in their country, we had completed this project. So they managed to continue, the OPD staff managed to continue together with the resource teams, continue to work with the current existing networks that they have developed during the project, and that enabled them to go into the outer islands. But for Fiji's case, the COVID-19 response mostly centered in Vitilevu on the main island, and also around the border lockdown areas. But now that the borders have opened, we are able to also supply PPEs and also food rations to the north, as well as the wash facilities, retrofitting wash facilities are being conducted in the north for 10 homes of persons with disabilities. Thank you.
Thank you, Ruthie, very much. So building on that sort of theme, and thanks very much, Ruthie, for explaining how you were able to reach some of the more remote populations. I'm interested too in just about the inclusion of and reaching of an impact on women with disabilities. I might turn to you, Cucu, just to say from your surveys and your interaction with different OPDs in Indonesia, what were some of the findings and some of the impacts for women with disabilities?
Okay, thanks, Paul. Yeah, there are some like impacts that we found from the study. That's yes, women with disabilities, especially who are who are economically active, means that they have the income, but they need to go out for daily, for example. They're not working at the formal sectors, which they have like a salary, things like that, like a monthly salary, things like that. But the impact of the COVID itself, it has like really has the significant into their economic life, which they losing their job, for example, as the was it like a domestic assistant, something like that. Yeah, the domestic assistants, they lost their jobs because because of the pandemic, because the house owner cannot pay her anymore, so then she has to live with her parents, for example. And then also other findings that we found, that's also the difficulties of the having the access to the hygiene. That's also covered in the survey, I think. And then also in terms of the education itself, this is not really specifically to women with disabilities or girls with disabilities, but it's broadly to students with disabilities, because they has to do the learning from home or study from home. Has an impact that's because of the online lessons or online study is not yet really accessible to students with disabilities. It is then has an impact to not only the students but also to their parents, because it's often that's the teacher, for example, ask for certain homework, but then because of the accessibility, and then it's the homework is like done by their mother, for example, and it is then give the or adding the burden for women in general, I mean for the mother, and that has an impact to the psychologically to the children, to the students, where they need to catch up with the education. So those we found, those were the findings from the survey. Also but also in the survey, we our question was not only the negative impact, but also what are the contribution or the positive things that DPOs or people with disabilities can do during that the pandemic. During the pandemic, one of the thing is that how then the DPOs like against or combat or against the hoax or misinformation regarding the COVID and vaccine. This is very crucial. So those are the example, and then it's always like including women with disabilities into their movement. So I think those the findings that we have from the survey.
Thank you very much, Cucu. And just a follow-up question to that, and then I'll come to you, Manish. But Cucu, you were sort of talking about how the online was able to sort of facilitate better connection within the movement. Is that correct?
Yes, that is in my observation, that's incredibly unexpected, because as well, I was in the engaged with disability movement. I myself, as a wheelchair user, has the involved in the movement since years ago, and then I feel that since last year, since we did the survey, we initiate the WhatsApp group. We call it DPO's network. We call it Web Cuci. Web Cuci is like a discussion through the WhatsApp. So it has then more and more DPOs, and even like young people with disabilities are now getting into the forums. Now it's a lot of a mainstream organization, if I could say, mainstream organization who have discussion, for example, in the forums in any different topic or thematic. Then they will consider about the providing sign interpreter, for example. This is something that's I can see the changes from these outbreaks. And also now it's like in the national televisions, it always has the, even still small, but it's always provide with the sign interpreter in the news, whenever they have the news. And also, of course, for people who has not yet internet connection, still, well, it's not perfect yet. There are people are still left on the behind because of the area, the internet coverage area. But again, because of the contribution of DPOs, they were very actively getting their members, getting their community, and also working with the mainstream organization to ensure that disability inclusion needs to discuss, needs to consider on the thematic. Yeah.
Sure. Okay. Thank you very much, Cucu. That's really interesting to hear that, and that's really fascinating. In fact, just a final question before we wrap up, and just Manish, we've only got about a minute to give to wrap up the answer to this one, but just could you just briefly talk about the impact of COVID on people with psychosocial disabilities and mental health, and your work with CMC? What have been the impacts and the main work there? Just in about a minute before we wrap up.
Yeah, thank you very much. Yeah, that is very important one. I think at the beginning when we did our rapid assessment, at that time we did not consider that issue much seriously, because it was kind of overall type of survey. So later on we worked one study for the Ministry of Health and Population. We focused our study to the psychosocial disability, autism, intellectual disability, and some other persons with disability who have multiple impairments and who are very, who comes under the a bit severe disability case, a severe impairment case. So in that study, we found that basically the impact of COVID to the persons with psychosocial disability is really very hard, and it's very panic. And because basically to get information, proper information and right information, and making them aware of the information, because that increased their stress more, and that the situation increased the fear factor among them, and their stress was still, and they also we in our survey we also found that they lost their regular treatment. That is most vulnerable things, because of this lockdown and different types of stigma and different types of travel restriction. They had to face lots of problem in getting regular services like psychosocial counseling and meeting the doctors, psychiatric doctors, and meeting and taking medicine, all these things. So the market was closed, and they could not get the medicine from the market on time, and they had to face lots of problems. So that was the really very big impact to the persons having psychosocial disability. Yeah.
Thank you, Manish. Yeah, I can absolutely relate to that. And I think there's still quite a lot of challenges ahead. And look, we're out of time, but I think it's been a really fascinating and engaging sort of lessons and presentations. So I'd just like you to all join me in thanking Cucu and Ruci and Manish. It was really great to have you there with us today. We really wish you luck in your work ahead. Thank you very much for your presentations. I think we've all learned a lot. And I'd like to thank all our participants also for joining us today. And so thank you and good luck as we all work together to confront the epidemic. Thank you.
Thank you very much.
Goodbye.
Thank you very much. Goodbye.
Thanks, everyone.
Thank you.
Bye-bye. Thank
Bye.
you.